is Eric Dover. I'm a medical doctor and certified traditional tribal healer. I'm the director of Seli Wellness Center in Lake Oswego, Oregon. If you'd like to know more about us, please go to our website, bornagainhealth.weebly.com, and also see below this video for further information and that website link. This is the first in a series of presentations. This is Cancer, a Nutritional Disorder. Cancer is a Latin word and it means crab. The image to the left is a mammogram, radiograph of the breast. And you can see a white dense mass. In fact, there's a black arrow pointing upwards towards it. That mass was removed. It was prepared pathologically, sectioned, stained, and then you see the slide of it on the right. And you'll see arrows pointing to long, thin streaks. Those are the arms, the arms of the crab. That is indicative of a malignant cancer. It's growing outside of its normal boundaries. A benign cancer will be very well circumscribed. There won't be any little arms or tentacles coming out from it. When you see arms or tentacles like this, then it is almost 100% certain that it is a malignant cancer. Dr. Russell Blaylock is a neurosurgeon, very bright man. He's written some books in regards to cancer, and he considers it that there is a cancer industry out there. And as he says here, incredible amounts of money, resources, and studies have been put into conventional allopathic medicine, but still no cure for cancer. It's an industry. In other words, what he's saying is there's been a lot of resources that have been put into this, yet nothing is coming out of it. Is this planned? It certainly seems such, being that we do know that there are alternatives to what allopathic or conventional medicine is offering us. Basically, pharmaceutical-oriented medicine is what allopathic medicine is. In regards to cancer development, well, you see the photo on the right side of the slide, and you see a reddish colored cell, and as it's noted there, it's a cancer cell. And you've got a couple of yellowish colored cells that are coming and looking as if they're enveloping the cancer cell, and those are T cells. They attack. They physically attack and destroy dead cells, bacteria, viruses, cancer cells, etc. As it says here, we develop cancerous cells routinely. They're typically removed by our immune system unless it is not functioning in a healthy state. Causes of cancer? Well, we all know most of those, I assume, or at least have some idea. We've learned those throughout the decades, and things such as cigarette smoking, etc. But in regards to the main categories, we're looking at environmental chemicals, in particular fat-soluble ones, which tend to be organic chemicals. And the reason why those are concerning is because we have fat in our body, the chemicals lodge there, and they can cause long-term changes to DNA and lead to cancer. Radiation, whether that be radiation that is emitted from devices, or whether it be radiation that's emitted from radioactive materials like, let's say, the Fukushima disaster, or whether it be radiation that we receive when we have a radiographic study of some sort, an X-ray or CT scan. All those different types of radiation can lead to cancer. Viruses, certainly a well-known cause of cancer. Probably the one that's known to most folks is human papillomavirus, HPV, causing venereal warts, and which can degenerate into cervical cancers. That is basically the cause of cervical cancer, certainly penile cancers, vaginal cancers. Another virus that commonly causes cancer that many people probably aren't aware of would be hepatitis B and C, which can cause liver cancer. Chronic malnutrition can be a cause of cancer. A great reason for that being that the body just isn't functioning well. The immune system is shut down. We can't process toxins, etc., because all that's to perform those duties, for your body to perform those duties, you need to have a healthy nutritional base. Otherwise, you will not be able to process things that are ultimately going to cause harm to your body. And then chronic inflammation. Chronic inflammatory states lead to cancers, whether it be something, let's say, that's on your skin day in and day out or frequently, or whether it be an inflammatory type of process such as an autoimmune disorder like rheumatoid arthritis or lupus. All those autoimmune disorder folks, those patients with disease, with those diseases, and they're numerous. There's a number of them. All are at greater risk for cancer. A very common one that many people may be familiar with is ulcerative colitis, which is an inflammatory bowel disease and is an autoimmune disorder and can lead to colon cancer. In regards to cancer development, assimilation of chemicals in our body, whether it be artificial flavorings or colorings, pesticides, whether it be ones that are sprayed on your food or sprayed on your lawn or put on your animals to kill fleas. Additives of any sort to your foods or life. Medications, certainly we have to process those. Anything you put into your body that isn't natural to it, you're going to have to break down. Daily contact in the air and water, multitude of sources, multitude of chemicals. GMOs. We're finding that GMOs are altering DNA in organisms, and that certainly can lead to cancer. In addition, the chemicals that are sprayed on GMOs, like Roundup, certainly can also lead to cancers. Radioactive particles. We've got Fukushima that is still emitting chemicals through the air, but primarily through the water. We're coming in contact with radioactive particles still that were released into our environment with above ground testing in Nevada or in the Pacific Islands or all the other countries that have subsequently detonated nuclear weapons into the open atmosphere. Chemtrails. A lot of people don't believe in them. I do. I don't think there's much not to believe. It's in the government's own manuscripts. They talk about geoengineering. They even talk about how they're going to do it. They talk about how they've done studies with bacteria and watching how those flow through the air. Why wouldn't they release things that would alter our environment? We know that for warfare even, we've been doing that for a number of decades. Supposedly they were doing it back in the Vietnam War, where they would cause floods and whatnot. But otherwise, with the chemtrails, they are spraying those, so your atmosphere is being sprayed, and it seems to be at this point that the majority of it is aluminum and barium, but they have found white cells, red cells, radioactive particles, etc. Anyway, something to think about and research further on your own. Vaccines and associated contaminants. Well, certainly there's mercury and aluminum that have been in or still are in vaccines. But vaccines themselves can have contaminants that because of how they're grown. The first polio vaccine, the Salk vaccine that came out, had cancer viruses in it. And as a result of that, there was a dramatic rise in soft tissue sarcoma, malignant tumors that led to many individuals' deaths. They're very, very malignant cancers. And just a result of the vaccine being grown in kidney monkey kidney nephron cells, and the DNA has been contaminated with these cancer viruses. Hormones. Whether that be in the food that you eat, whether that be hormones you're coming in contact with because your water systems can't filter the ones out that come from people's urine, in particular, stool, we're coming in contact with hormones in many, many different ways. Heavy metals, obviously things like arsenic, lead, mercury, none of that's good for your system, and can lead to cancer development, not necessarily even directly, but through destroying your immune system, you know, not functioning like it should, not being able to take care of the business at hand in regards to cleaning up cells that are unhealthy. Here's just some pictures of chemtrails. These are some chemtrails. I took this outside my residence, and the horizontal lines are actually going north-south. Towards the left would be towards Portland International Airport, and the ones that are going straight up and down are going east-west. As you can see, some are stopping, starting. The day will start off blue, and the next thing you know, by afternoon, it's a hazy gray day, like there's been a fire nearby. I'm 57 years old. It was until 10 years ago, I never saw anything like this before. You can see these unusual patterns here. You see tic-tac-toe type patterns. You see these circular patterns. I've seen S-shaped patterns. I've seen where they crisscross in triangular fashion. It's just amazing what's occurring. And one thing that I've seen reported, one thing I've actually seen myself is one morning I walked out, there was some dew, and it looked like some bushes that I have were just covered with spider webs. And I'd never seen that before. So sent my son off to school, went over and touched one, and it just kind of dissolved in my hand. It was nothing like a silky fiber. And went and washed off my hands, and came out a couple hours later, and they had all disappeared, as had the dew. Come to find out, that's some type of toxic material, a chemical that will be sprayed from the jets, and that should not be touched. Should not be touched. I'd heard of it before, but that was the first time I'd witnessed it myself. As you can see, I mean, if you were in a jet that was blowing smoke like that, you'd wonder if it was on fire. We've all been in enough jet airplanes that we know that they're not blowing anything like that. So as far as your risk assessment of cancer development, well, obviously the carcinogens that you're exposed to, and there's numerous carcinogens that you can be exposed to. And so the intensity, which would be the amount and the frequency that you're exposed to these carcinogens, and divided by your resistance. And also of importance is, especially in youth, is when you're, or in utero even, is when you're exposed to these carcinogens. Because in one study involving mice, on a certain day, if they were exposed to dioxin, they would develop certain types of cancers. They were exposed on either day, on either side of that day, they didn't get the same problem. Obviously, mice's gestation is condensed into a much shorter period than human beings. So maybe there might be broader windows for human beings, or maybe that, there's obviously a longer time period in utero that you can be hit by these particular insults. Dr. Harold Manners, very interesting gentleman. Encourage folks to look into him a little bit more closely. He was a biologist. He landed at Loyola University in Chicago, and he was there in the late 70s and fell right into the Laetrile controversy time period. At that point, he thought it was worthwhile looking into. He made sure not to take money from either side, either the pro or anti-Laetrile people, and did his own research and encountered a lot of flack, a lot of negative press, etc. Much of it most likely being pushed by the pharmaceutical folks. Anyways, as he states here, carcinogens do not always cause cancer. They can, however, cause cancer if the body conditions are right. So if you're already ill, if you've got immune suppression, if you're being exposed to multiple different things at the wrong time in your life, all those things can lead to cancer. But just being exposed to them does not mean that you will develop cancer. It's like a gentleman or a woman that smokes for 90 years and dies of a toenail infection. Never developed cancer, had no problems with COPD, and no concerns whatsoever, and did not die as a result of their cigarette smoking. But that's not a game. That's not a game you want to play. It's like Russian roulette. As far as immunity, there's two types of immunity. There's cellular immunity and there's humoral immunity. Cellular is like what we saw with the earlier picture, where the two yellow T cells were attacking the reddish cancer cell. It's a direct attack. Whereas humoral immunity involves the production of antibodies. So you've got lymphocytes, and there's different types of lymphocytes, just like there's different types of T cells. But lymphocytes produce antibodies, and then those go and attach and attack and direct your body's immune system to say, hey, there's something wrong with this particular entity, whether it be a cell or your own cell or a bacteria or a chemical, an allergen, etc., and it goes and attaches, and your body makes a response. It's a marker, you might say, for your immune system to spot something that is not appropriate or not considered to be part of your system. Your gut is 50% of your immune system. Hard to believe, but your gut is an incredible processor of the outside world. Your gut is basically the outside world. It's just a tube going through you, a convoluted, twisted tube that goes through you, and everything in the center of that tube is the outside world. And there's obviously bacteria and parasites and all kinds of things that go through that system, poisons, chemicals, heavy metals, and your gut's going to react to those things because it has such an immense immune system set up there. Greatest risk of developing cancer is when your immune system is weakened. Don't think we need much more discussion there. And here's just an illustration, a cartoon of your immune system. As you can see on the left, it says B cell differentiation. That would be your lymphocytes. And then on the right, you have the T cell differentiation, which would be the cells which are the T cells, which directly attack abnormal cells, bacteria, etc. And they all congregate in areas like the lymph nodes. Not the only place they're at, but that's one place where they're certainly residing. Now, immunity is adversely affected by surgery, as you can imagine. I mean, the surgery, they're disrupting your body, and then your body has to heal, and it's going to put it down a little bit. But what affects it even more so is the anesthesia. Anesthesia is basically poison. And if it went any further, you'd die. When you give someone anesthesia, forget about even their immune system, which it definitely suppresses for a couple of weeks or so. But just the way a person is able to act, or their mentation after receiving anesthesia, it really interferes with it. I know that from personal experience, and certainly the older the individual is, the longer that can last for, because the older a person is, typically the slower their metabolism will be, and they will retain the drug within their system for a longer period of time. Also, a lot of anesthesias are fat soluble, so they're released slowly from those fat cells. That's why they can have an extended effect on your body. Blood transfusions, unless you're having an auto transfusion, which is where you took blood from yourself before your surgery. You took a unit and they stored it away in case there's any problems. So you're going to have your gallbladder out, and they just want to make sure that, in case something goes awry, they've got some of your own blood to stick into you. Then you're not going to have any problems with that. Anybody else's blood, unless they're an identical twin, you are going to react to. There are proteins, just even the smallest nuances of differences between your siblings or your parents. And certainly you get beyond those individuals, it becomes even more convoluted in regards to protein differences. But as soon as you get a blood transfusion, you will most likely never be able to receive that same blood again because you will make a reaction to those proteins. So every time you get a blood transfusion, it gets more and more difficult to transfuse you. And as you're making reactions to those blood transfusions, that is going to affect your immune system. Your immune system is being sidetracked, you might say, by this situation with the blood, when really what you need to be doing is you need to be healing. Psychological stress in and of itself can cause defects in your immune system. Very typical one is people getting stressed and getting cold sores. Poor nutrition, again, you gotta have the nutrients to be able to function correctly. You got crummy gas, your car isn't going to run very well. Carcinogens, toxins, poisons, certainly those have a direct effect on your immune system. Carcinogens carcinogens that induce cancer can stimulate our immune system at one level in a negative way. That's what I was talking about, where if you're exposed to allergens or you're exposed to proteins, let's say through a blood transfusion, and you're trying to heal and you need a healthy immune system, well, carcinogens will come in and stimulate the system in the same way and kind of sidetrack your immune system so that all of a sudden it's paying more attention to those carcinogens than it should be to the other duties that it has to deal with. But at the same time, the carcinogens can directly suppress your immune system. In other words, it can directly suppress them and make them unhealthy. So it's like being exposed to carbon monoxide. You get carbon monoxide poisoning. It may not be enough to kill you, but it certainly will make you pretty sick. And that's what these carcinogens can do. It can make your immune system sick. So in one way, it can stimulate it and distract it because it's an irritant inside your body, but at the same time, it can suppress it by making your immune system sicker. Especially as time goes on, it's more likely to get sicker if there's continued exposure. Now, inflammation results in increased risk and incidence of cancer, as we had discussed earlier in regards to irritants of any sort or people that have autoimmune diseases that have chronic inflammation. Also, though, inflammation increases the aggressiveness of the cancer. So the more inflammation you're being exposed to, the nastier that cancer typically tends to be. Now, there's two different thoughts in regards to cancer development. There's the orthodox or the allopathic opinion. We discussed allopathic medicine being basically pharmaceutical based. And that is that the assumption that cancer cells are de-differentiated mature cells. In other words, you've got a lung cell, and for some reason, it goes and reverses itself from being a mature normal cell and reverses course and goes back to a very immature, de-differentiated, aggressive growing cell. Thing is, cells don't differentiate backwards. There's been no studies ever to show that occurs. Also, it tends to lead us down a pathway of genetic research, which seems to be the direction we're going. Moving away from even chemotherapy drugs and going more towards genetic ways. You see in the newspaper where they're going to, treat people's cancers by altering the DNA within the body and try to make these cells more mature that way. Unfortunately, this is all rooted in the assumption that cancer is a local phenomenon that just, occurs for some reason out of the blue in just this one spot, which just doesn't seem to be what happens in practice out there. So the alternative opinion is that cancer is a systemic disease and that any localized treatment will ultimately prove itself to be worthless. In fact, this alternative opinion, which was really formulated about 100 years ago by Dr. Otto Warburg, W-A-R-B-U-R-G, a genius, had 2 Nobel Prizes for science, who came up with this entire theory. He was able to find these cells, and he was able to prove basically what was going on with cancer with the methods of investigation that we had at that time in our history, which were incredibly sophisticated. We had incredibly bright people that were able to take those really very sophisticated equipment that they were able to put together, microscopes that they can't even reproduce at this point in time that they had produced back then, and to be able to research and come up with these theories and thought processes of what's really going on that have unfortunately been discarded by the folks that find it more beneficial to make money off illness than to actually cure people. Now, in a normal healthy cell, they utilize aerobic metabolism. In other words, they take sugar, they take oxygen, and they burn it aerobically. And it produces 36 ATP. ATP is our body's gasoline. And that's per glucose molecule. So 36 ATP when glucose is burned with oxygen. Now for cancerous cells, got a totally different story. First of all, they utilize 5 to 10 times more glucose than a normal cell does. They basically are vacuums for glucose. They utilize what we call anaerobic glycolysis. So anaerobic means without oxygen. Basically, it's fermentation is what it is, just like if you're making beer or wine. The yeast are fermenting the sugar and producing alcohol. Now, when you use fermentation or anaerobic glycolysis, you only the end result of metabolizing that glucose is 2 ATP glucose, or 2 ATPs per glucose molecule. So you're talking a 34 ATP difference between aerobic and anaerobic glycolysis. Now, even within the cancer cells, a small amount of aerobic metabolism occurs, and I won't go into why that is, but just suffice it to say is that the cancer cells have been altered to a point where they've reverted to the anaerobic glycolysis, but there still is a slight amount of aerobic, a few percentage at most, that goes on. Now, cancer depletes ATP, and we'll get to that in just a minute as to why that is. The reason is that you need 6 ATP to convert the 2 lactic acid molecules to 1 glucose, or back to glucose. Again, there'll be a graph for that in just a second that will show exactly what I'm speaking to. So anyways, you produce 2 ATP with anaerobic glycolysis per glucose molecule, yet you need 6 ATP to convert the 2 lactic acid molecules that are a result of the anaerobic metabolism back to the 1 glucose molecule. So you end up with a deficit of 4 ATP, and that has to be stolen from somewhere else, and it's from healthy cells that are producing ATP aerobically. Now, amino acids are also directed towards cancer cells preferentially. Again, these cancer cells are growing and metabolizing very rapidly. They need lots of amino acids to make enzymes, to grow in size, etc. And here's the illustration I was speaking to. As you can see, the illustration on the left I like the best. You can see glucose there in the lower left corner. It produces from 2 ADP are converted to 2 ATP, as we were discussing, which results in 2 pyruvate molecules, which then subsequently are converted to 2 lactate molecules. And you can see on the right that there's a process that the pyruvate goes from. It goes from pyruvate actually all the way to glucose, back to glucose. But suffice it to say is that the pyruvate molecules are switched over to lactate molecules enzymatically. And then that lactate, as you can see in the subsequent, or in the illustration on the right, is subsequently turned into glucose. And again, that takes 4 ATP molecules extra. So a total of 6 ATP molecules to be able to convert that back into glucose. Now, when they talk about cancer, they talk about a cancer cure. And when physicians speak of a cure, what they're actually talking about is survival rates. And depending on the cancer, and depending on where we're at in regards to our history of cancer treatment, those survival rates obviously change. A 3-year survival rate, 5-year survival rate, 10-year survival rate. There's a certain percentage of people that are associated with those numbers that will survive. So there might be a 50% 3-year survival rate. And then there might be a 2% 10-year survival rate. Again, it's not a cure. Not saying that there can't be a cure of cancer. People can be cured. But just to give an illustration, there was a woman that I knew personally. She had been diagnosed with melanoma. 10 years later, everybody thought the melanoma was gone. She walks into her living room. Her husband notices that she's slurring her speech. Turns out she has 3 metastatic lesions to her brain that were melanoma, and she died within a month. So it was lying there dormant. For whatever reason, it turned back on. So having a cure is, using the word cure is a very relative term. What really is, should be best looked at is the best way to put it would be control, and hopefully keeping it in a dormant state so that it doesn't flare back up again. Now, cancer survival rates have increased. And this is what we're being told. This is what's in the literature. But there's reasons for this. Number one is we're detecting these cancers much earlier. Just like your computers have improved dramatically over 20 years, these same computer systems are being used with radiographic studies to give you better definition, and give you other abilities to be able to more readily define what you're looking for. Maybe to intensify things. Or with PET scans, we can look at heat. We can see where there's areas where there's a lot of metabolism going on, etc. So our methods of detection have improved dramatically. Also, unfortunately, there's been manipulation of study data. Pharmaceutical companies are basically, they're paying for all this research. They're underwriting it all, and they have complete control over the results of this research, to the point where they've had the researchers sign contracts saying that they are basically gagged. They're not allowed to speak about the research at all. In fact, a woman physician who was highlighted on 60 Minutes about 20 years ago that tried to speak out publicly about what the research she had done really showed, and immediately she was slapped with incredible lawsuits. So, again, the data is being cherry-picked. There's a lot of problems with research in our medical institutions at this juncture of medical history. Otherwise, there's also been improvements of other medical treatments that haven't been taken into account. Should we take other disease states that are associated with ill individuals, hypertension, diabetes, autoimmune disorders, a myriad of different things, neurological disorders, etc. And as we've been able to treat those and improve those disease states, that certainly is going to help someone with an additional burden such as cancer to survive longer. The other thing is that the chemotherapies themselves, well, some of those have gotten better tolerated. There's newer ones that are somewhat better and easier on the body, you might say. But also we have medications, let's say, for severe nausea and vomiting that are very strong antiemetics or other drugs that we can help diminish the side effects of the cancer treatment. As we all know, cancer results in fatigue, cachexia being weight loss, as a result of the cancer, growing so rapidly, and again, basically just stealing from, the healthier tissues, in particular sugar and proteins. Cancer also results in inflammation, as discussed earlier, or as we will discuss later in this video, that just metabolism in and of itself results in inflammation, results in free radicals. So cancer, which is at a very high metabolic rate, obviously is going to do the same thing. It's going to cause inflammation and produce lots of free radicals. So one way to actually measure the amount of inflammation is to measure C-reactive protein. This is done frequently in patients that are suspected to have cardiac disease, and it can give us some idea of what their relative risk of developing a heart attack is, because obviously, as we found, cardiovascular disease, inflammation is a big and maybe the primary component of why people develop plaques and clots and subsequent ischemic events. Also, we can measure ferritin levels because ferritin and iron is what ferritin is. Iron helps produce a lot of inflammation in the body, again, through production of free radicals. And the other thing is cancer likes iron because it needs it to be able to produce DNA so it can divide and grow. In regards to chemotherapy agent categories, we won't go into detail of these, but you can see the different types. There's alkylating agents that attach to DNA and cause breaks to occur. There's anti-estrogens, things like Megace, tamoxifen, that block estrogen receptors. You see that, you see those given to women with breast cancer, and puts them into immediate postmenopausal symptoms. There's anti-metabolites, which you have something that imitates a major metabolite in your body, something like methotrexate, mimicking folate. Anti-tumor antibiotics, which induce free radicals within the cells and therefore interfere with cell reproduction. There's plant alkaloids, which inhibit cell division. They bind to a material within your cells called tubulin, which is necessary for this, to be able to pull the cell apart and help it divide. There's topoisomerase inhibitors, which interfere with cell division, and the enzyme topoisomerase, which is necessary for cell division. And here's a picture of some of those very pretty poisons that they put into individuals' bodies on a routine basis. You can see cytotoxin, which is cyclophosphamide, adriamycin, doxorubicin, which is an antibiotic type of chemotherapy drug. There's bleomycin, which just destroys the lungs and the heart. Now, chemotherapy drugs are poisons, and they're poisonous to cancerous and normal cells. Certainly, the more rapidly a cell divides, the more toxic they are. That's what these chemicals are trying to target, is rapidly dividing cells. Most of these chemotherapeutic agents are mutagenic. They will cause mutagens. They will mutate your DNA, and could lead later on to, if you're a young woman and you become pregnant, could later on lead to abnormalities of your baby, congenital defects. Or it can also mutate your DNA so that you form a cancer later on after having been treated with these chemotherapeutic drugs for another cancer. Also, these chemotherapeutic drugs tend to basically choose for a more aggressive cancer that's more likely to metastasize. It tends to select for it because the cells that are more susceptible will die more readily, but the ones that aren't as susceptible, those will be resistant, and those are the more aggressive cells, and they are more likely to metastasize. So it isn't that it necessarily creates them, although it can, because it can mutate them. But also it selects for them. And also, as we discussed, it can cause new cancers, chemotherapy, or in particular leukemias and lymphomas. In regards to complications and side effects of chemotherapy, obviously there's fatigue, nausea and vomiting, which we're all aware of, but then there's acute versus delayed nausea and vomiting. Now, it's difficult to control the symptoms, whether it's acute or delayed, but certainly the delayed symptoms, which can occur months, even years later, are incredibly difficult to control. There's aversion to food where you don't feel like eating any food. You get a sore mouth and throat. Hair loss is very common, as we all know. And depressed production of blood-forming cells. That's the number one reason why people have to discontinue chemotherapy, because you're about ready just to destroy the patient's ability to make any cells, platelets, red cells, or white cells. Other complications are cardiac toxicity. That can be acute or delayed. Very common one is congestive heart failure because of destruction of the heart cells. There's pulmonary toxicity, and there's scarring that can occur to the lungs. GI complications, something called leaky gut syndrome in particular. Now, your gastrointestinal system very infrequently will, or I shouldn't say infrequently, but only a very small percentage of food that's ingested is taken up as a whole element in regards to being a carbohydrate or a protein through pinocytosis. Majority of it is broken down into smaller peptides, smaller sugars, or into basic amino acids or glucose. Uh, you know, disaccharides broken down into their monosaccharides. Anyways, with the leaky gut syndrome, it's easier for these larger uh, molecules to get across the gut barrier and get into the lymphatic system and get into the venous system and the arterial system too. And then your body starts making possibly and typically uh, immune reactions. And again, this is something that is going to complicate your situation because now your gut is becoming inflamed and it's responding to these materials that it shouldn't have to respond to, but it's a result of you being on these poisons, which are not only killing your immune system, but also, as we discussed earlier, inflaming it. There's liver injury, kidney injury, neurological complications, directly onto peripheral nerves, where it can destroy peripheral nerves, or it can destroy or interrupt your blood-brain barrier, where things that typically wouldn't be able to get across into your spinal column or into your spinal cord or into your brain, all of a sudden are able to get into the cerebral spinal fluid and attack those two structures, the brain and the spinal cord. The other treatment is radiation therapy, which, as we all know, it burns the tissue. And again, there's acute delayed damage to the tissue that can occur. Certainly with acute damage to tissue, there's going to be all kinds of dead cell debris to deal with, all kinds of inflammation to deal with as a result of the burning. And the other thing is that radiation's harmful effects are cumulative. That's one of the concerns about mammograms. Unfortunately, we've got this epidemic of breast cancer, so now we're, quote, forced to do mammograms on women, yet every time we do a mammogram, we're cumulatively increasing the chances of her developing breast cancer because the radiation is causing damage to the DNA. And that's a cumulative effect. Once you cause that damage, it doesn't typically reverse itself. Here's just a photo of before and after, or I shouldn't say before, but then back in the old days, that's a little boy with, he had ringworm on his scalp, and they would radiate it. And unfortunately, that led to a lot of brain tumors. I guess that was another way we figured out that there was that radiation can cause cancer. And then on the right, you see the new modern, very focused type of radiation machine. In regards to chemotherapy and radiation therapy, as we discussed earlier, the most vulnerable cells are those that have a rapid turnover rate. So that's, again, cancer is growing rapidly. And so just like anything that turns over rapidly, it's going to be growing rapidly in addition. So that's going to be targeted by these therapies also. So your gastrointestinal tract, people don't think of it turning over rapidly, but it has a very high rapid turnover rate for cells within it. Bone marrow, in particular in regards to red cells, white cells, platelets. Your lymphatic system, again, that's where as we saw earlier, where lymphocytes and T cells reside. Your spleen, which also has a lot of, it has a capability of producing red cells and white cells. It also has a lot of white cells in it, just as the liver does too. The reticuloendothelial system, as they call it. And then hair follicles, as we all know, people lose their hair when they get chemotherapy or radiation therapy. But remember, all tissues are injured by these treatment modalities, acutely and chronically. These things are poisons. They're going to affect your entire body. Like anything else, some things are just some systems are more susceptible than others. I'd like to get into a discussion of free radicals. Now, 95% of free radicals are produced by our own body's metabolism, just normal day-to-day metabolism. So free radicals are something your body has to deal with on a day-to-day basis. Now, anytime you're ill or sick or there's been damage to your body, then you're going to produce more free radicals. In fact, exercise, it's not low-grade exercise, but certainly people that are training pretty hard, going and let's say running a hard, 20 minutes, they're going to be producing, more free radicals. Their free radical production is going to increase. And in regards to your DNA, it's exposed to up to 10,000 free radical impacts per cell per day. 10,000 per cell per day. Now, there's different types of DNA. There's nuclear DNA and there's mitochondrial DNA. And the mitochondrial DNA, unfortunately, is 10 times more sensitive to the damage by free radicals than the nuclear DNA because the mitochondrial DNA just doesn't have as many DNA repair enzymes. So it's really, unfortunately, at risk. And then iron and copper increase free radical production, as we've discussed earlier. And it's just a graphic showing the formation of free radicals, ultraviolet light, metabolism, as you see there at little purple structures of mitochondria producing energy. And just like anytime you produce energy, I mean, your car, sure, it produces water and CO2, but it also produces a lot of other things too. Things that aren't good for your body, and as you can see with the air pollution, the air pollution is producing free radicals. So your car and your body, anything that's burning carbon is going to produce free radicals. It's inevitable. Inflammation, smoking, obviously, ionizing radiation. Now, free radicals increase as cancer develops and spreads. Again, cancer is growing very rapidly. There's a lot of metabolism going on, so there's going to be a marked increase in free radical production. And as a result of that, the cancer is going to become more aggressive. Again, those free radicals cause DNA damage. The cancer cells really don't take the time to repair their DNA, and so it just makes the cancer more aggressive by causing more and more DNA damage. It also, with increased aggressiveness, it also becomes more resistant to treatment. And as we discussed earlier, there's basically two populations of cancer cells. Not to say that there isn't some continuum. It isn't like a distinct black and white or aggressive versus more susceptible. There's a continuum, but there certainly is a population at that one end that is very, very resistant and very aggressive, and at the other end, there's a very susceptible population that isn't very aggressive. And antioxidants, there they are. All those beautiful, colorful vegetables and fruits, that being the tomatoes, full of antioxidants. And here's an illustration, a cartoon, showing a free radical. It has an unpaired electron, and you take a stable chemical, and through oxidation it can become a free radical by removing that electron. And then, as you can see on the left there, an antioxidant can come along, and it can share its electron with the free radical, and then that stabilizes that chemical again. I like the illustration on the right a bit better. You can see the antioxidant donates an electron to the free radical, which has an unpaired electron. The antioxidant at that point becomes a free radical itself. That's why you just don't want to be taking in one type of antioxidant. That's why you want a mixture of antioxidants in your system. Antioxidants are taken up by the cancer cells in a much higher concentration than normal cells. That's a positive, although a lot of, or most of your oncologists will tell you that's a negative because it will interfere with some of the chemotherapy that is given. Antioxidants, though, have been shown to prevent cancer progression at all stages and to enhance the conversion of immature cells. Again, cancer is an immature cell. Whether you go by the allopathic method or theory, which says that it went from a mature cell and de-differentiated into an immature cell, or whether you go through go by the theory that I believe is the correct one, where you take very immature cells and they turn into very aggressive cancerous cells. But either way, antioxidants help convert these immature cells that are cancerous to more mature cells, and that makes them more stable. It makes them easier to deal with. It also makes it such that the cell, when it goes to a normalized state, can then go and self-destruct like it's supposed to when it becomes ill. Now, this is what antioxidants can do. They can enhance your detoxification systems. In particular, that's your liver. You need antioxidants, you need nutrients to be able to break down things that your body considers to be foreign and wants to get rid of out of your system. And the more of them that you have in your system, the more of the nutrition, the antioxidants, etc., you're going to need to be able to manage that. The antioxidants induce apoptosis, which is the death of the cell. Again, it normalizes the cell, also turns on genes that have been suppressed in the cancerous in the cancerous state of the cell, and all of a sudden, when it becomes more normal, it turns those genes back on, and the cell is able to self-destruct like it's supposed to. They also inhibit critical cancer growth signals. So your cancers are, they're sending out all kinds of enzymes. They're sending out their own hormones, all kinds of different signals. And so one thing is a growth signal, and the antioxidants help block that. They also block essential enzymes needed for tumor growth, invasion, and angiogenesis. Angiogenesis being the production of new blood vessels. They also block the iconosinoid pathway, which means that there will be a decrease or a complete stoppage in inflammation, a decrease or complete stoppage in immune suppression, or it will stop or slow down tumor growth and metastasis. These iconosinoids become prostaglandins, and some of these prostaglandins do different things, but some of them will cause inflammation, immune suppression, and will lead to metastasis, or increased risk of metastasis. Now, Dr. Jerome Block, I trained under Dr. Block at Harvard UCLA as both a medical student and as a intern and resident. Very, very bright, brilliant man. And what's always been stated, as I said earlier, by oncologists, is that antioxidants aren't good for you to be taking. Now, they won't tell you to stop eating vegetables. They'll tell you to eat vegetables. They'll tell you to eat anything you can get into your system, even things you shouldn't be putting into your system, like sugar, as we discussed earlier. But they'll tell you not to take supplements or other things that are touted as being, very high in antioxidants. But again, they're okay with eating vegetables. But as he says, the hypothesis that antioxidants inhibition of free radical activity may negate cytotoxic properties of some cancer therapies have been dependent on naive and inaccurate assumptions. And he's correct. Again, what he's saying is that the idea that these free radicals that are produced by, that are induced by these chemotherapeutic drugs are then rendered mute by the fact that these antioxidants are somehow interfering with the free radical activity from these chemotherapeutic drugs. It just isn't true. The research doesn't bear that out. There's nothing to show that that's correct as far as the theory is concerned. Now, as far as diet disease, increased consumption of processed foods, preservatives, artificial colors, GMOs, additives, pesticides, along with exposure to a whole host of other environmental insults, seems directly correlated to increases in cancer, inflammatory disorders, obesity, hypertension, diabetes, etc. All our diseases in westernized countries are increasing. And I'm certainly not pinning it on one particular cause, but there's no doubt that the foods that we're putting into our body and the chemicals and toxins and poisons associated with them and the hormones associated with them are having an effect on us. Here's a slide, the incidence of cancer in Great Britain and how it's increasing. And you can see it starts off at about 1980, and then it goes up to about 2011 as far as what they predict there. And then the prediction continues out to 2030. And you can see in males there's going to be a 55% increase they predict, and in females a 35% increase they predict by 2030. Here's childhood cancer rate changes from 1975 to 2008 in the United States. And overall, you can see the one line, all cancers, they've increased over that, about 38-year period over 30%, about 35, well, more like about 40, 45%, or excuse me, about 35 or 40%. But you can see testicular cancers, brain cancers, all up over 40, 45%. Just amazing what's occurring. Some of it have decreased, but overall, cancers have increased dramatically in children and in adults. Autism, from 1975 to 2009. Now, in 1975, they're saying that 1 in 5,000 young people were diagnosed with autism, because they weren't diagnosing them as older individuals. I don't remember anybody when I was a kid having autism back in the 60s and 70s. But back in the 50s, supposedly the incidence was 1 in 20,000. That was probably the genetic type of autism that is called Fragile X syndrome, which my family is personally affected by, and I'm personally affected by. Anyways, as time has gone on, here we are in this graph where it goes up to 2009, and 1 in 110 are being diagnosed. Now, folks will say, oh, that's because they're finding these people that were going undiagnosed before. Baloney. You don't go from 1 in 5,000 to 1 in 110, and now we're up to 1 in 50, with Oregon having the highest risk of autism out of any other state in the nation. And here is a graph of glyphosate, which is Roundup, and autism. And as you can see, as the glyphosate being produced and being spread over our crops, as it's increased, in particular being applied to corn and soy, so has autism dramatically. But it isn't the only thing that can be graphed out this way. There's other things that are in our environment and that we're being exposed to, or that we're intentionally exposing people to through increased numbers of vaccines, etc., that will give you the same exact look on a graph. Nutrition is not taught to physicians in medical school, yet physicians are considered the experts on it. Very little in regards to nutrition is taught. Very little is taught to physicians in regards to, let's say, something such as fluoride, which is a little off topic, but suffice to say is all you're taught is that fluoride is good for you, good for your teeth. Very little is said. They don't tell you that the initial findings came out of a town that wasn't getting sodium fluoride, but calcium fluoride. What they put in your toothpaste is sodium fluoride. It's pharmaceutical grade, so it doesn't have any contaminants, but the fluoride itself. In water, they put other types of fluoride in. Small percentage of municipalities put in just industrial grade fluoride, which will have heavy metals, etc. in it. The other type of fluoride, which the majority of municipalities use, over 90%, is silicate fluorides, which are derived from the waste products of uranium mining and fertilizer mining, mining for any type of material, basically, where there's going to be a high amount of fluoride there, and that is extremely contaminated. And a lot of that comes from China. And they're putting this into municipal water systems. Unbelievable. So anyways, getting back to the nutrition, how physicians aren't taught about nutrition, you can tell that just from looking at the majority of hospital food that still exists in the majority of our hospitals. So they've gotten better, but most are way behind the curve. And they're devoid of nutrition. They're made out of GMOs. They're high in bad omega-6 fats and animal fats. They're contaminated with pesticides, additives, colorings, etc. They're not organic. And here's a very common hospital meal. You got potatoes that are definitely full of pesticides. They're not organic, so they're definitely going to be full of pesticides. You've got some type of mystery meat covered in gravy that's probably made with dairy products and it's got hormones in it. And then you got some kind of vegetable that's probably overcooked and the nutrition's gone out of it, and a slice of white bread with some butter on it. The white bread just being nutritionally deficient in general, and just being a sugar that's being injected into your system, more or less, along with the potatoes, which are basically just sugar at that point after being cooked. Now, in regards to nutrition, there are very few studies on cancer and nutrition, as you imagine, because there's no money in it. If they can just tell you to eat nutritionally correct and get the right supplements and the vitamins that are made appropriately and have the right concentrations and are devoid of things that actually may cause problems as opposed to help you, that doesn't cost nearly as much as if you need to take a medication for a lifetime or if you need to go into some expensive type of chemo or radiation therapy and all the blood tests and hospitalizations and everything else that goes along with the entire scenario and situation. And as you see on this slide, here's the 800-pound gorilla. This is why you're not going to get the kind of studies you should be getting. This is why you're not going to be getting the truth of what you should be getting, because here you've got the number one dollar spender in regards to lobbying from 1998 to 2012 was $5.3 billion that came from the pharma, healthcare, and HMO industry. Basically, all the other ones added up, they certainly exceed, but they're certainly a fraction of what the healthcare industry is spending to lobby our politicians. It's been noted that approximately 50% of all cancers are diet related. Now, that's eating things that are toxic. Again, dyes, additives, hormones in our food. The other reason being is that we're eating foods that suppress our immune system, or we're just not getting all the nutrition that we should be getting. We're nutritionally deficient, so that leads to cancer also. And as noted below that, there's a 50% reduction in the incidence of cancer in those eating the greatest amounts of fruits and veggies. You need to eat your fruits and vegetables, and not just small amounts. There was a study done on patients that were going in for surgery. In one study, they looked at those individuals and they found that 60% were nutritionally depleted. They looked at a more sophisticated method of measuring nutritional deficiency, and 85% of those folks were deemed nutritionally depleted. It doesn't surprise me. Looking at the food that's in our grocery stores, looking at the foods that are sold at restaurants, let alone fast food institutions, it's no surprise to me at all that people are nutritionally deficient. Even the ones who are eating fruits and vegetables, most of them are eating conventional fruits and vegetables, which means they're nutritionally devoid because they're not grown organically and getting the minerals and vitamins that are in the soil that they should be getting. They're getting basically just water that may be contaminated, and they're getting fertilizer, and then they're being coated with pesticides. Cigarettes, big nutritional depleter. Got to break down all those chemicals going into your bloodstream through your lungs. Excessive alcohol consumption. Again, you got to break down all that alcohol. Anytime you're breaking down something, you're using something to be able to do that. Just like if I was breaking down a wall with a sledgehammer, I've got to use energy to do that. Just like if you're going to break down cigarettes or alcohol, you've got to use energy, and you've got to use enzymes, and you've got to use minerals, you've got to use vitamins to be able to get through that process, that metabolic process. Numerous allopathic medications. Again, they're not natural to your body. You got to break them down, metabolize them, and typically urinate them out. Unless, in a couple other ways, defecation, breathing them out, or sweating them out even, but typically through urinating them out. Carbonated soda, in particular, it tends to deplete magnesium. A lot of magnesium deficiency out there, and most people don't know it. Magnesium has a very narrow range. There's a lot of reasons for people having cardiac problems, and that's the result of magnesium. Arrhythmias, dysfunction of the heart in general. And most of the doctors are not even measuring that. They're certainly not supplementing for it. And then the other thing is even if you are going to supplement for it, you've got to know the right type of supplement to use. You could be using something that has no effect in regards to absorption whatsoever in regards to magnesium or any other mineral or vitamin or supplement. Toxins. Again, you got to break them down. And as we've discussed previously, high exertion exercise. Again, you're going to be forming free radicals. You've got to be able to, get those under control, and it's going to take nutrition to be able to do that. Plus, when you're exercising, you're breaking down cells. You're breaking down muscle. You got to rebuild it back up, and that's going to take nutrition, vitamins, proteins, etc., to be able to do that. And stress. Stress bad in every way of it. Your body requires much greater quantities of nutrition under these circumstances. Medically, we have known for a long time that heavy alcohol consumers have proportionally less alcohol-related disease the better their nutritional status. So you've got some guy that's wealthy and someone's cooking his food and they cook very nutritional food and they're imbibing a lot of alcohol. They won't have the same disease problems associated with alcohol that a guy that lives out on the street and basically drinks his meals and is nutritionally deficient. Less likely to develop cirrhosis. Let's say something like Wernicke's encephalopathy. The guys living out on the street, they don't have any vitamins. They come into the emergency room. First thing we do is we hang a bag of saline with sugar. It's got multivitamins that are injected into it, but then we've got to give them a thiamine shot, because if we don't, just giving them glucose can throw them into something called Wernicke's encephalopathy, where all of a sudden they lose control of the muscle function of their eyes. They develop ataxia, where they have instability of their movements, and they can also develop confusion. So it's very important that when people come in and they're considered to be nutritionally deficient, you can't just start throwing sugar at them. You've got to make sure that you start building up their nutritional status before you even consider giving them something like glucose. As we discussed earlier, iron's a problem with cancer. Iron's required for DNA replication, and there's a lot of replication going on in those cancer cells. So iron is not our friend in this situation. In fact, really high iron levels are our friend in general, as we saw earlier, because they lead to increased free radical production. And that may be one of the reasons why people that have something called hemochromatosis, which causes cirrhosis of the liver, because they have high iron levels, also could develop liver cancer, probably because of that increased free radical production. So allopathic medicine is looking for a magic bullet, a single magic bullet in many ways. And they'll try to do that either through their allopathic drugs, or they'll try to extract something from natural substances, and they'll try to utilize that one substance and see if it will cure the cancer. Let's say like taking one entity and just throwing that at the cancer and hoping that takes care of all the problems. It just isn't going to happen. It's, as you can see in the slide, it takes everything. It takes all these different vegetables added together to give us the nutrition, and to give us the vitamins, and give us the minerals, and give us the antioxidants that we need to be able to fight this disease, this curable disease. So eat your veggies. Greatest anti-cancer effects are seen with cruciferous vegetables, but hey, any fruits and vegetables are good for you. Certainly darker, deeper colors have more antioxidants, but any fruit or vegetable you eat is good for you. You eat an apple, it doesn't have to be some dark-colored apple. It's got quercetin in it, and quercetin is an incredible antioxidant, incredible anti-cancer substance. So mortality from conventional treatment of cancer depends on the nutritional status, which means the immune status of the patient at the time of treatment. So we have a right, in my opinion, to choose what we want medically. And there is a buffet, a smorgasbord of choices that are out there, anywhere from conventional to very alternative to very traditional. And cancer has been around for forever. It isn't just a result of man-made problems. There's cancer that has occurred before that for different reasons. And there have been very ancient people and what some people would call, they would call them very unsophisticated. But these people knew about their plants, and they knew about substances, and they knew that you had to have a strong immune system and you had to be strong nutritionally, and you could fight off these diseases and reverse them. So if someone's going to go, if they're going to choose a conventional treatment for cancer, that does not mean they should not consider a nutritional treatment in addition, because every study has shown that the more nutritionally fit your body is before you go into that cancer treatment, whether it be surgery and or chemotherapy and or radiation therapy, the better your outcome is going to be, the better you're going to tolerate those treatments. So nutrition can strengthen collagen barriers along vessels to prevent metastasis, because the vessels don't have a strong barrier, then the cancer cells can get through them more easily. They can reduce tumor invasion and metastasis. There's a glue that's between cells called integrin, and there's obviously enzymes, etc., that are put out by the cancer cell, and nutrition can help keep that from occurring and stop them from being able to break down the integrin and move their way in between other cells and become metastatic and grow. Nutrition can reduce angiogenesis, the formation of new blood vessels. And the blood vessels that are formed with cancer are much leakier. They have gaping holes in their basement membrane, and it makes it much easier for the cancer to metastasize. So, just to kind of recap, nutrients interfere with cancer reproduction, division. They cause cancer cells to die through apoptosis. They inhibit cancer-dependent enzymes, which are related to growth. They inhibit inflammation because the cancer cells are producing icosanoids, which can lead to prostaglandins, which lead to inflammation. And they can also inhibit tumor invasion by decreasing cancer cell-produced enzymes. They can block angiogenesis. They can exert anti-hormone effects, especially in the breast, prostate, colon cancer regions, or colon, in particular in breast, prostate, and colon cancer. And they can also act as chelating agents. Iron, think iron, to chelate that, get that out of your system. First by not allowing it to be absorbed, and then also literally drawing it out of your serum. And the nutrition helps improve liver detoxification. Again, any drugs that you're on, chemotherapy, or you're breaking down, cells are dying, etc., your liver's going to have to deal with that entire process, and it's going to have to detoxify that. If your liver isn't healthy, look at a newborn baby that gets jaundice. If the jaundice is too high, they've got to treat that. Otherwise, that can lead to damage to the baby's brain. So, the liver isn't mature enough, that's when the baby becomes yellower. Again, if you don't have a healthy liver, you can't detoxify your system. And here is Saleh Wellness Center. Again, encourage you to explore what we do. We are in Oregon, but certainly because of our tribal licensing, anyone is able to come from anywhere in the United States and sign up as a member. This is a private institution, and it's very small fee. You can sign up an entire family for almost nothing, and come and be seen. We would love to see in regards to cancer, rheumatological problems, autism, attention deficit disorders, high blood pressure, diabetes, a whole cornucopia of illnesses that can be treated just with nutritional intervention alone, and getting people on the correct supplements and vitamins, ones that are easily absorbed, ones that are effective, and ones that actually get to the root of your problem. Please go to our website, bornagainhealth.weebly.com, and you can see that information in the box below this video. Hope you enjoyed the presentation. If you have any questions, please feel free to email me. There will be an email link in addition. Please feel free to email me or make comments on the YouTube channel site.